Today on the show, I'll be talking to Howard Reis, the CEO of Teledentist.com, on a very interesting topic that's near and dear to my heart, which is teledentistry and how it will impact telehealth in the future. Welcome to the show, Howard.
Thank you for having me.
So, Howard, you have a unique background. I'd like you to tell our viewers a little bit about, you've been in telehealth and teledentistry. Can you talk a little bit about your background and experience in the telehealth industry?
Sure, happy to. I'll make it brief, but I've actually been in telehealth for 30 years, and that goes back to working. I actually started on the tele side, working for 9X, large telecommunications company, before they became part of Verizon. And 30 years ago, 9X had big pipes. We were trying to figure out who was going to use them, and pretty quickly decided that the medical imaging was going to be one of the industries that needed big transport. And I had the opportunity to be a project manager for a trial with 4 of the Boston teaching hospitals in areas like teleradiology and telecardiology. So it was a great opportunity to, for me. It really started a career at the intersection of telecom and healthcare. A lot of the time was spent in teleradiology, working with a couple of very successful teleradiology companies, and really teleradiology was the first medical specialty to successfully use telemedicine as a integral part of their offering. I joined the Teledentists 18 months ago, really with the intent of bringing to teledentistry some of the success that I've seen in the teleradiology space.
So talk to me a little bit, to teledentists. You and I have talked quite a bit in the past, and you're unique in a bunch of respects, actually, in the teledentistry industry. Can you talk a little about the types of things you do at Teledentists and how maybe you're a little bit different than some other teledentistry companies that folks might see?
Happy to. There now are a good number of teledentistry companies. Most of those teledentistry companies enable a dentist to provide software so that they can conduct a video consult like this with their patients. We do that, but what makes us unique is how we really got started is by establishing a national network of dentists. And we've got 300 dentists providing video consults on a 24/7 basis. We've got dentists licensed in every state. So, in addition to being a software provider, really the main line of business is providing access to our dentists. And we're doing that directly to the consumer on our website. We're working with several major insurance companies like Cigna and Anthem. Our service is available to their members through their portals. We have established our first employer health clinic where we're working with Cerner Corporation and with actually a physical facility where we have dental teams showing up during the week, and we'll be supporting that after hours and weekends with the teledentists. And next month we'll be working in our first major hospital where we will be connected to the emergency room. So really the intent is to be anywhere that a patient is presenting or in need of expert dental care. And that's a pretty unique place to be right now.
That's really interesting. Myself coming from the healthcare industry, that was one of my goals when I entered dentistry a few years ago from a technology standpoint, was to kind of bridge that gap between medical and dental. Can you talk about some of the pilot projects or some of the use cases when we're talking about how telehealth or medicine itself is using teledentistry now and maybe in the short-term future. Can you talk about some of those projects that might be going on that you're aware of?
Well, you really can't have a conversation about telehealth these days without talking about the impact of the pandemic that we're still in. And in terms of telehealth, I mean, certainly it's been all over the news. And the number of patients that have now used telehealth, the numbers I've seen, where before the pandemic you were in the 5% range, and now we're in the 70 or 80% range. So, patients are using telehealth, they're satisfied with telehealth, and we can talk a little bit about patient satisfaction, but, they're finding this as a great alternative for not having to travel to a doctor or a dentist for what really is, in many cases, needing to have a conversation, or telehealth can be used as a screening tool to see, do I really need to come into the office? So as patients now become comfortable with a video conversation with their provider, if the patient is talking about a toothache, or the patient has a mole that they want the doctor to look at, it's not very different. That this is a telehealth conversation. You're helping the patient at a distance. The patient has a real concern. You have medical expertise, which technically can be delivered from anywhere, and you're just providing such significant benefits, in terms of cost benefits, not having to, do the transportation and immediacy. You don't have to wait weeks for an appointment. You can see a doctor or a dentist on demand.
You and I have talked a little bit about, healthcare organizations and how you're starting to see more and more embracing oral health, and then along with that, obviously teledentistry. Can you discuss any knowledge you have either with projects you're working on at Teledentists or other projects you know of in the industry where you're starting to see healthcare in general, telehealth, starting to embrace the idea of teledentistry or oral health? Maybe you can give us a little bit of insight into some of the conversations you've had with healthcare organizations.
We've spoken with lots of healthcare organizations, and almost universally there is a acknowledgement that oral health has to be part of oral health. And certainly have had conversations with people that are treating critically ill patients, and oral health is one of the components of a potential treatment plan. So what the patient really wants is to have a team at their disposal that can take care of all of their healthcare needs, and not necessarily needing to go different places or be pointed in different places. For critical aspects, the team can all get together on a conference like this. One of the nice things is, and you also have the ability to include family members. So it brings into play so many additional capabilities that are not, now if somebody's going to the doctor's office, they're not even allowing a caretaker to go in with them. So again, it really goes back to looking at oral health as a component of overall health, needing to be as part of the treatment plan, and providing access, at the point of care to the expert that's most able to help the patient.
So you had mentioned in the beginning that you're a little bit unique in that you offer software to dental organizations for teledentistry as well as your network. So is the network, besides being offered to patients of groups and practices, are consumers using your service as well directly to your teledentist? Can you talk a little bit about that?
Absolutely. No, I mean, again, somebody needs to see a dentist now, they come to the teledentist.com website. There's a button to push that says see a dentist now. We ask them to complete just a few basic forms about their complaint and their medical history, and we are in all cases, or just about all cases, able to connect the patient to a dentist to have a video conversation in less than 10 minutes. So,
So I'm sorry. So one of the challenges we have, and it's interesting when I talk to teledentistry companies because we're obviously at the tip of the iceberg on features, functionality, technology. But one of the things that we talk a lot about is potential integration. How do, somebody using your platform and then a dental software from a documentation standpoint, from a scheduling standpoint, can you talk a little bit about kind of your knowledge of integration where it is today, maybe even with your company, with dental software, and also kind of where you see things going with technology, any potential integrations with dental software and even medical software?
sure. Um, Today, when we see a patient, our dentists complete a pretty thorough report about the exam, and that report is available both, it's certainly available to the patient, and it's also available to a healthcare provider that may be doing follow-up work with that patient. The services we basically provide, we remediate the problem, we e-prescribe, we get a prescription sent to a local pharmacy, and if necessary, we actually will get that patient scheduled for a visit with a local dental office within 24 to 48 hours. That's been a little bit of a challenge with the pandemic and dental offices closing, but if that patient needs to see a dentist, we will help them, we will get that visit scheduled. We will make sure that the report that the dentist has um, uh, put together is available to that subsequent provider. So when you talk about integration, the way we do it now, we create a PDF and we send that report through electronic mail, and that report can be attached or become part of an electronic medical record.
You and
There
I,
will be
I'm sorry, go ahead.
integration where that is done through an API, and at the click of a button, that's going to be included, directly as part of the, either the dental software or, medical EHR. And that's really dependent on there being enough volume and demand to create that capability. It's not a difficult challenge. It's just, it does take a little
Sure.
time, more money to create that API and that
Sure.
integration.
So speaking about the crossover between, medicine and dentistry, which we've talked a lot about, it sounds like you do foresee a time where medical software, a medical EHR, for example, in an ER or some other healthcare group, might actually be able to bring on the teledentistry visit as well, right? Would integrate. So if you have perhaps an ER doc that has an oral health issue that they need a consult, they might not necessarily have to go to a separate teledentistry platform, but are you seeing that the movement is that at some point the medical systems will be hooked into applications such as yours and other teledentistry platforms?
Well, one thing that we've talked about, and I mean, the teledentist is powered by a telehealth platform that's been optimized for dentistry. So some of the major telehealth companies use the exact same underlying technology that we use. So in those cases, the integration is easy or easier. Never talk about technology being easy. I always get surprised. But to answer your question, the answer is yes. The key phrase you used is, at some point in time. I'm hoping that that's sooner rather than later, but one of the challenges with uh, with EHRs to me has been overall integration. That's got to be easier for everybody. But I'd like my dental records to be part of my personal medical record, and I'd like that to be easily available to any physician that I see. And in our lifetimes that will happen, but it's not right around the corner.
Are there any specific projects, pilot projects, any things you're working on with your company, with healthcare in general, with telehealth that maybe you can talk about? I'd like to kind of give a glimpse into where things might be going in this area.
Well, one project that should be kicking off next month, we are going to be working with a major health system in Michigan, where the teledentists will be connected directly into the emergency room. And there'll be someone in the emergency room with a tablet and a intraoral camera. And if a patient is presenting with a dental issue, they'll be connected to the teledentist. So, that's one place where that integration is just about to happen. And again, you'll also have the ability for a dentist to directly consult with a physician in support of that patient and the problems that
That's really exciting. Is this a health organization, given your telehealth background in the past, is this an organization that you were familiar with? Did they come to you kind of, I'm really interested because as we move into teledentistry, crossing over to telehealth, I'm kind of interested in how people talk about it, how the health organizations get together with groups such as yours. Can you kind of give us insight into kind of how that connection happens or will happen between
I'm
healthcare in
shaking my
general?
head a little bit because this has been in development for, let's just say, many months.
Mhm.
And it usually starts with a champion in the healthcare system that is excited about the opportunity to make this happen. Oftentimes, they do have a telehealth program in place or have seen a particular, case or a need for a service like this. And, there's an excited internal champion that wants to make it happen. What I have found with healthcare systems that slows the process down is that, the bigger the healthcare system, or sometimes the larger the healthcare system, there are multiple decision makers. You have to, satisfy pretty rigorous IT requirements. You have to, satisfy all of the legal issues. You've got issues of licensing and credentialing. So it's not just as easy as, oh, here's a link and you know, you know, tomorrow we can provide you with a link and you're connected to our system and our dentist. It's everything else that's around it that really you have to literally dot the i's and cross the t's to make it happen.
Yeah, I think you're right on there. I can certainly relate to that, Howard. From my experience years ago in the medical industry, helping clients get medical software, I remember working with like larger medical organizations. You're absolutely right. There can always be a champion that wants to do something, but then these larger medical organizations you have to jump through hoops, and everybody has to have a say. So I can probably appreciate what you go through trying to connect with some of these organizations. So
But let
that's
me give you, another example. Companies like Cigna and Anthem, similarly large organizations. What got us going was literally the pandemic and the need to do something quickly, and patients in need. And one of my favorite quotes from the pandemic came from the procurement person at Cigna who told me, "Hey Howard, we just got done in 6 days what usually takes us 6 months." So we got that agreement in place. We got the service up and running literally in less than 2 weeks. And then we've spent the next 6 months now working on the long-term agreement. And, thankfully, we now have a long-term relationship where we will continue to provide service. But it was really a crisis that made people move very quickly.
Since you brought up the payers, I think you and I have talked about it. That's payers, insurance companies are going to be a more important part of this industry, this teledentistry industry moving forward. Can you talk a little bit about your thoughts on that? How insurance companies are important in the growth of this industry?
Absolutely. I mean, again, let's go back to the beginning of the pandemic, and there were several things that happened, that really made this all possible. There were things on the telehealth side. Some of the rules were relaxed. We can talk about that. But the fact that teledentistry is now a reimbursable item, and most of the insurance companies, whether or not they actually offer teledentistry to their patients, if the patients are having a teledental consult, with their dentist, they're able to, submit that, and it's getting reimbursed. So, the insurance companies, realizing that, people couldn't physically go see their dentist, agreeing that telehealth was or teledentistry specifically was, a way to help them during the pandemic when they couldn't see a dentist. And the big help was providing reimbursement. And that reimbursement has always been one of the bugaboos, I'll call it, of telehealth, why it hasn't taken off more quickly. And I mentioned early about my background in teleradiology. Radiology figured it out, and radiology interpretation has always been a reimbursable expense, and that's why teleradiology took off a lot more quickly than the rest of the telehealth industry. So, insurance
That's
has been a
interesting.
major factor, and specifically reimbursement. And now, like Seema Verma from the CMS says, the genie is out of the bottle. There's no going back. You will continue to see this, not as a substitute, but there's so many benefits from a telehealth or a teledentistry consult. Patients still don't want to go to the dental office. They can see their dentist. If patients are going to the dental office, the first time, if it's a new patient, the first time they see a dentist, they may be in full PPE with a face mask, and all you see, is the dentist's eyes, and the patient is nervous to start with. Wouldn't it be great if the dentist or someone on their staff could meet the patient with a video chat for just 5 minutes before they come to the office? Don't you think the patient is going to be a lot more comfortable, about going through with whatever's necessary? So, the benefits are countless.
Well, it's certainly been interesting talking to you, especially given your telehealth background and again, my passion bringing together medicine and dentistry. And I actually hope to talk to you further because I think we're just at the tip of the iceberg on all this. And I'm sure you and other teledentistry companies are going to be producing some very interesting features, functionality, and use cases as we move on. So again, I know you're a busy guy. Thank you very much for your time and chatting with our viewers. And I look to talk to you again in the future.
Look forward to it, Mike. I apologize for the ringing phone. And when we talk again, I'm going to talk a little bit more about how e-commerce is going to be part of the future of both teledentistry and telehealth. And I look forward to talking
Hey,
to you about
Howard, that's actually par for the course. That's the way the world is these days with conferences. At least you didn't have a dog or a child jump on your shoulder. A ringing phone isn't that bad, right? So
children are all out of the house.
thanks again.